Can I begin by thanking all noble lords who raise important points in this debate, but also for accepting some of the amendments that we have tabled in response to their noble lords' engagement. I thought the engagement was very constructive, and I hope as we look to hold the government accountable that we will continue to have engagement on these issues. I wonder if I could first of all just turn to a couple of specific questions. The first, Noble Baroness Tyler asked about the identifier again. As I've made clear, the report will include an explanation of the government's policy on a consistent identifier for children. It will also include the government's approach and actions to implement the recommendations set out in the report. Now, we all agree that the principles of a consistent identifier are right. There are complex issues around applying that consistent identifier in safeguarding children. This is why we want to investigate all the issues thoroughly in the report, which will be laid before Parliament a year after commencement. One of the issues that I'm personally interested in, I'm sure noble lords will remember that I geeked out on this. I think there are some technical solutions, but I also think I can see some technical unintended consequences. And I myself will be looking very closely at the report, and particularly the sort of technical solution to solving this issue. Can I also, like other noble lords, welcome, good to see my noble friend Lord Chinquin back, and thank the noble lord for my noble friend for engaging with me. I almost from the bed, hospital bed, I think, which demonstrates a commitment that my noble friend has to these issues. In terms of raising the issue of speech and language therapy, the government does recognise the importance of communications needs, and that plays a really important part in children's development. We will work with stakeholders on the development of guidance, and we will ensure that we engage with the Royal College for Speech and Language Therapists. If I can now turn to Amendment 59, brought forward by Noble Baronesses Lady Hollins and Noble Baroness Tyler. The Government and NHS England are committed to ensuring that the ICBs specifically consider the needs of babies, children and young people. The NHS England performance assessments will look at a number of the ICB duties, including improvement in the quality of service and how to reduce health inequalities. Now, these duties apply to the whole population, including babies, children and young people. The bill also places a duty on NHS England to have regard to any guidance published by the Secretary of State in connection with assessing the performance of ICBs each year. The guidance can include provisions for the assessment to particularly consider children and young people. The bill also places a new duty on the Care Quality Commission to review integrated care systems. The bill proposes that these assessments will review how ICBs, local authorities and providers of health, public health and adult social care services are working together to deliver safe, high-quality and integrated care to the public, including children and young people. The amendment also addresses ICB's duties in relation to safeguarding children and children with special educational needs and disabilities. Now, to ensure appropriate accountability for duties, we have agreed with NHS England that their statutory duty will provide that responsibility for these functions should be delegated to an ICB executive lead. NHS England statutory guidance will also clarify that the ICB annual report must set out how they have discharged their duties in relation to child safeguarding. We are aware, or we should be, probably look at the issue around the 2021 Alan Wood review and a cross-government safeguarding children reform implementation board, which DHSC jointly chairs. We did review Sir Alan's recommendations, and ministers have discussed them with him. Officials continue to work with Sir Alan to embed his findings where appropriate. If I can now turn to Amendment 64, 66 and 68 and 75 and thank my noble friend Lord Farmer for bringing this important topic before the House, but also for engaging and pushing us on this issue, which clearly is very close to my noble friend's heart. We do agree that ICPs and ICBs should work closely with a range of organisations to consider the whole needs of families. But I would stress it is important that there should be a degree of local flexibility, as we have discussed earlier. The package of bespoke guidance which I've previously mentioned will cover services that my noble friend considers part of family help and the role which family hubs can play. We also intend to include in statutory integrated care strategy guidance that family hubs, where appropriate, should be considered in the integrated care strategy, where there are opportunities to further integrate its arrangements with health and social care services. My noble friend Lord Farmer will also be aware that a range of work is ongoing in this area. The independent review of children's social care is still considering the definition of family help, and the definition may well be further refined as a result of the ongoing consultation. I would gently ask Noble Lords that the government is given time to consider the findings of that review and its recommendations. My noble friend will also be aware of the upcoming ambitious programme of work with 75 local authorities to develop effective family hub models. But I must gently remind my noble friend and other noble lords that as a matter of good governance, good law and the proper sequence of events, the government feels that it should wait for the care review and our work to develop family hubs models at scale before drawing implications for the statutory framework for either. Doing otherwise risks jumping the gun or being premature. Also, while in principle the government strongly supports and champions the move to family hub models, they need to be able to adapt to local needs and circumstances. They also need to operate affordably, making use of a diverse range of local and central funding streams. And in both these regards, local democratically elected councils hold the ultimate decision-making power over whether to adopt a family hub model and how it should function. And although I note the welcome efforts of my noble friend to soften its impact, we believe that there is still a risk Amendment 75 would pose an additional burden on local authorities in their delivery of local services. It's for these reasons that I asked my noble friend and noble lords not to move their amendments when reached.